please unmute? Okay, so please recite after me. I am my sister's keeper.
I am my sister's keeper.
I will build my sister up.
I will build my sister up.
Encourage her.
Encourage her.
Empower her.
Empower her.
And pray for her.
And pray for her.
I have no reason to talk about her.
I have no reason to talk about her.
Tear her down.
To tear her down.
Jealous of her.
To be jealous of her.
Or to compete with her.
Or to compete with her.
I am going to stand behind her.
I am going to stand behind her.
And help push her into her destiny.
And help push her into her destiny.
Pretty women pray.
Pretty women pray.
Okay, thank you, everybody. Thank you. Thank you. Okay, so I'd like to go right in and introduce our guest speaker, Jacqueline Ndirangu. We have shared her bio with you. We've shared her profile. We've shared a picture of her beautiful self. I've known Jackie for, I was just thinking about it. I've known Jackie for, I think, almost 13 years. I met Jackie at my husband's 40th birthday. She came with mutual friends, and over the years we've become friends. And Jackie often talks, she travels a lot for work. She's often in South Africa. And she's always talking about the work that she does as if it's something so commonplace and something that everybody can do. And I've always thought, wow, this woman is doing amazing things. And so I finally got her in a space where she was available to come and talk to us. It's going to be, I think, quite an intense discussion. The critical intersection of HIV, unintended pregnancies, substance use, and violence. And so without any further ado, I'm going to hand over to Jackie. Jackie, thank you so much for being with us this evening. Over to you.
Thank you so much, Sheila. Can you hear me?
Yes, we can.
Great. Thank you. And thank you, G4G, for having me. I've heard so much about the group and just the amazing things that everyone is doing at G4G. And it's such a pleasure to present some of my work to young women, and especially that's my passion, is really working with young women. So I really look forward to a good discussion. I'm going to try and go through it quickly. It's a lot. I was through the slides, and there are a lot, and there's a lot of words. So I'm sorry. I'm going to try and be as quick as possible, and then also just try not to be too intense, because I know it's the evening, and I don't want to overwhelm you. But I will go ahead, and I think I'm able to share, correct?
Yes, you should be able to.
Okay, first of all, let me I want to move you all so that I can let's see. Okay. All right. Actually, I will just let me just put I'm working on multiple screens, and I seem like my face is looking at a different direction. Okay, can you let me look at which is the, yeah, okay, good. Can you see this? Oh, great.
Yes, we can.
Okay, great. Okay. All right. So I'll touch on the just being empowered and being aware, just understanding the intersection of substance use, violence, and HIV. I will add in unintended pregnancies, but that's part of the HIV connection. But generally, I will talk about just the nexus and how there is an overlay between substance use, sexual risk, and also gender-based violence. So just a quick note about me, and I think you already found, got it in the in the blurb, but I'm not going to go through all this. But really, my focus is in disease prevention among women, and especially young women. And I started this a while ago in HPV, which is a human papillomavirus prevention in Haiti. And I'm currently working in projects in Cape Town, South Africa, and in Kenya. Okay, so let's start with substance use. I know a lot of us, have our occasional wine, our occasional whiskey here and there. So when I'm talking about substance use, I'm not talking about that occasional drink. So don't think I am, I'm trying to call you out. It's I am talking about, drinking to the point of having three or more, and I'll actually show you what it is. And some of you might be shocked at it, because you might think, wow, I normally have 4 drinks, but not 4 drinks every day. So generally in substance use, I will talk about alcohol, we'll talk about other drugs, and I will talk about drugs that are prevalent in South Africa because that's where I've worked for a while in Pretoria and in Cape Town. And as you can see at the corner there, in the syringe, that's heroin, and heroin is normally it's quite expensive to take heroin. So heroin is normally laced with like battery fluid and like rat poison and different, and also marijuana. And actually that's when that's nyaope in itself, because it's a mixture of the different drugs with just a little tinge of heroin. And the thing, and we'll talk about heroin itself, that heroin is quite addictive. So if somebody is thinking that they're smoking marijuana, they need to know where they're actually getting their marijuana from, because some of the dealers lace the marijuana with heroin, and that causes addiction. Because marijuana will take you a while to be addicted to it, or you might never be addicted to it. And then we have methaquilin, which is mandrax. Mandrax is not very common in, sorry? Oh,
No, sorry.
mandrax is not very common in Gauteng. It is very common in Cape Town, and it's known as tick also. And it's called tick because it makes a tick tick sound when they're they put it on a spoon and heat it, they put it under a flame to make it liquid, and it makes a ticking sort sound, and that's what is known as tick. And then we have ecstasy, which look like fun buttons, Alkaloids, or I don't know what's the other sweets you normally eat, but it's actually ecstasy. So let's go quickly into just substance use in itself. So, alcohol and drugs use in South Africa, and I'm just talking in South Africa in general because that's where our experience is, and it's widely used by both men and women. And really, alcohol lowers the body's ability to fight off disease, and this is excessive alcohol use, as I mentioned before. And alcohol use also affects men differently than women differently than it affects men. um and also and that's why you see when you, like some of you, when you go out, you get higher than the actual than what men are drinking. And then also cannabis, which is dacha or marijuana, and tick and mangroves have different effects, and we'll talk about that quickly. And then I mentioned about heroin and or nyaope, which is quite popular also in Gauteng. Generally, all drugs, even alcohol itself, even the times when you felt a little high, really puts you at a risk for abuse and risk, and we'll also talk about that. So why is alcohol so risky for women? Alcohol itself is a downer. A downer means that it makes you sleepy, and it makes you very lethargic. And the issue with alcohol, it's so normalized. Everybody drinks, and nobody really checks on each other to see how much somebody else is drinking. And when somebody blacks out, you actually think they're sleeping, but it's really the body's way of just shutting down. And there's some people who, with continued blackouts, can actually not wake up, because it's the body's way of regulating and saying, like, I've had enough. But then people continue drinking. Another reason why women alcohol is so risky for women is that women have less water in their bodies than men, and they weigh less. So this really gets women higher as opposed to men. And then also there's a lot of issues when it comes to drinking in general for both men and women, and we all know about liver problems, heart disease, and cancer. Um, Another one I'll talk about at the end of drinking. I'm not saying that don't drink alcohol, but drink it moderately. And also for every glass of water, for every glass or bottle of beer, not bottle of wine, beer of drink, you drink a glass of water. So just quickly, I was just showing I don't know that you can see this diagram. It just shows that, somebody can say, I'm having 1 glass of wine. What all those measure to. So like 1 glass of wine is equals to almost 1 beer, or 1 can of beer. And so if somebody is having 4 glasses of wine, they've had almost four beers, and they've almost had 4 tots of whiskey. And that's what I said, in terms of excessive drinking, your brain, especially for those who are below the age of 25, because the brain continues to develop until the age of 25. The brain is like grapes. So for those, especially like students who binge drink in college, what happens is that their brain cells really shrivel, and they look like raisins, as you can see, here, which can have a detrimental effect later on in life. So quickly, we talked about mandrax, and we talked about alcohol being a downer. Mandrax is also a downer, and it really just slows your body down. First, it makes you excited, and then after some time, you may lose consciousness and feel like vomiting. And then you just sort of feel sleepy. And so what happens is that if a large amounts of mandrax, you can get into a coma. And what it is that once you start taking these drugs, whether mandrax or heroin, and these are hard drugs, is that you'll always be chasing that fast high. The first time you take it, you're going to feel so exhilarated, but you'll never feel like that again. And you'll keep on wanting to chase that high. And that's why people are always saying they're trying to chase that dragon, is that they're trying to chase that high, but it's really hard to get to that very fast high. We talked about methamphetamine, and again, methamphetamine can be sniffed, it can be crushed, and that's an upper, meaning that it keeps you very excited and you can stay for hours without sleep. And so what happens is that, your body is supposed to sleep for 6 to 8 hours. So if you're not sleeping, your body is not functioning as it should. Also, people who are on tick become, I don't know if that's the right place to say it, but um they want a lot of sex. And this also causes them to have condom-like sex. And also, unfortunately, sometimes if especially like for a man, if he cannot find sex, rape has been reported. Um, Heroin and unga, we just mentioned that. And so heroin is a downer, and just like alcohol. And so it also makes you really want to you're just very chilled, very relaxed. But the thing about heroin is that the withdrawal, once you start, it is really hard to stop. And the withdrawal symptoms are like a flu. It is really, really hard. And sometimes if we've had people saying that they go cold turkey, that means that they don't take any heroin. It has to be mostly under supervision, because you can feel like you're about to die. And so it's really, really hard to get out of heroin, but you can actually do it, especially like in a rehab center, or using other methods, like a drug that is injected in your system to sort of counteract the issues of heroin. We talked about ecstasy again, and ecstasy is also an upper, and because you're so stimulated, this is known as a club drug. A lot of people pop the buttons when they're out clubbing to keep you just awake forever, to dance forever. But also this can cause like a heart attack and violent behavior, and also you just eat, and it can really cause some grave danger. Let me know if I'm going too fast. Sorry. Okay. And then we talked about daca, or weed or marijuana. And, ever since, weed was legalized in South Africa, everyone's smoking it. Even the kids in school, in high school are smoking it. Um, you know, Unfortunately, at a young age, it will affect the brain and the heart. You know, um, we normally use it maybe like to ease pain for older people, but young people really, it just really stimulates you, it keeps you high, and then also the thing is, because you're smoking it, it's like a cigarette, and so it can cause chronic coughing, it can cause bronchitis and lung damage. And then, as I mentioned again, you have to be careful where you buy your dacha, because there are people who lace the dacha with heroin or cocaine and you would not know. And once you start, you will want to buy that same dacha from the same person, because you're like, I've never felt like this before. And then also studies have shown that daca with time, especially for young women, it can cause infertility. And also if you're smoking daca with an unborn baby, it can cause brain underdevelopment. And then also it just really weakens the ability of the body to fight off disease as it should. And then we talk about injection risks. These are injection drugs that are injected. Heroin and cocaine are normally injected. They can be sniffed, but they can be injected. The issue about injection, first of all, is that you can get hepatitis C, which is very common, and the treatment is extremely expensive. And a lot of people who get it are not able to afford it, and can die from the infection. And then also sharing of the needles can cause HIV, transmission of HIV, and I'm going to talk about it just when I sort of put all of these together. Okay, and so why do women sometimes take drugs and alcohol? Sometimes they take them to reduce their shyness around men. And sometimes and sometimes women who are using alcohol and other drugs are not able to protect themselves from for protected sex, and also from any danger of victimization. Um, and sometimes women are trapped in situations where they have no control and they can't ask for condom use. And alcohol and other drugs, especially during pregnancy, can really harm the unborn baby. Okay, so I don't know whether you've been listening to me, but I want someone to tell me whether dacha is a upper or a downer.
You can also write in the chat if you
You can
don't
write it in the
try
chat
to speak,
too. Thanks.
although
Yeah.
if you're from G4G, you should not be afraid to speak.
Why is it an upper? Yes, Arato, it is a downer. Correct, correct. Okay, and then methamphetamine, we talked about tick. Well done, Antonina. Yes, it is an upper. Remember, we talked about how you can be up for hours, and sometimes people who are on tick really demand for sex, and they can actually go and and try and rape someone to get sex. Okay, heroin or unga, is it a downer or an upper? Is that a Alia? Okay, good. Yes, uh-huh. Heroin is a downer. Heroin is a downer. Okay. Alcohol, this one should be easy. Yes, correct. It's a downer because it makes you kind of sleepy and and lethargic. Mandrax, the buttons. Oh, good. Decalo, yes, it's a down. I'm not sure that it's this from the previous question, but yes, it's a downer. Cocaine, yes, cocaine is an upper. And ecstasy. We mentioned that ecstasy is a club drug, so it should keep you up, right? So, because nobody wants to be at the club with a downer, although we drink alcohol, but yes. All right. Okay, good, good. Thank you for listening. Okay. All right. So let's move to violence quickly. Um, so 1 in 3 women worldwide really experiences either physical or sexual violence, and surprisingly, it's from an intimate partner. I didn't put it here, but it doesn't really have to be sexual or physical. It can also be emotional. It can also be financial violence. Um, Also, female genital mutilation is also a form of violence for those people who practice it. And then also only less than 40% of women who experience violence really seek help for it. So there's a lot of trauma and a lot of violence that happens, and there's no women don't want to discuss it due to societal reasons, and also just fear of retribution and stigma. As I mentioned again, majority of the violence that happens is really with a intimate partner. That's like your boyfriend or your husband or someone that you're seeing. And also women who are trafficked also really experience extreme violence. So in general, abuse is any form of behavior that controls another person. And as I mentioned, it be it physical harm or fear, and that's emotional. And also anything that makes a person do things that they don't want to do, and also prevents things that they want to do. As I mentioned, abuse takes different forms, and also women experience multiple forms of abuse. And just to let you know that although there's high form of abuse in South Africa, the laws are there to protect women from abuse. So just myths and truths about abuse. So the myth goes around like women abuse is private, which is not true because a crime is a crime, whether it's a family matter, whether it's done in closed doors, whether it's committed publicly, that it is a crime. And the South African law actually states that. A husband has a right to beat his wife. That's not true. Unfortunately, over half of the women who are murdered and killed are normally killed by their partners. And those who survive are normally hospitalized and have severe injuries. Another myth is that victims provoke abuse by their actions or behavior. You've heard, this girl was dressed in a very short dress. She talked in this way, and so she deserves to have been abused. Victims are never there to be blamed. Abuse is abuse. Another myth is if the abuse was serious, the victim would leave. So we hear a lot of people staying in relationships where they're abused, and we always say, oh, I don't know why she's there, or I don't know why he's there. They need to leave. But there's so many contextual barriers that prevent people from leaving really abusive relationships. And it could be fear, it could be financial dependency, it could be children that prevent the victims from leaving abusive situations. So sometimes it's really good to look at just the contextual issues and try and work with people who, especially like friends who are in abusive relationships, to sort of be able to come out of the rut that they are in. And also, only men abuse women. That's not true. Women and men can abuse each other. Oh, okay. This one was supposed to be. I was going to go to HIV and then and then so let me go into HIV. So just in general, there are 39.9 million people living with HIV worldwide. And the region with the most also that women and girls account for more than half of people living with HIV in the world. And the regions with the most women living with HIV, unfortunately, is Sub-Saharan Africa. And this is really due to, the just cultural norms, the gender-based violence, and just unequal power dynamics in relationships that make women more vulnerable to HIV. Again, adolescent girls and young women remain the most affected by the HIV epidemic. All the new, HIV has been there for decades. There are treatments, and there are all these other modes of preventing HIV, but we still ask, why is HIV still there? Unfortunately, HIV is still there, and it's increasingly the new cases of HIV are among young girls ages 15 to 24. So, and just to back what I just said is that HIV disproportionately impacts young women. Every week, approximately 4,900 young women ages 15 to 24 get HIV globally. And these really are from socioeconomic factors. There's poverty, lack of education, limited access to healthcare, and we mentioned cultural gender norms and places where women face gender-based violence. And then also the regions, again, I mentioned is really Sub-Saharan Africa. So we've heard of HIV. I'm just going to go quickly about what HIV is. And the HIV is this virus that destroys the body's immune system. You don't die from HIV. You die for complications of other diseases that your body cannot fight. In South Africa, unfortunately has the highest number of people living with HIV, and these are women. And HIV can be found in semen, in precum, and this is also blood. And when I say precum, this is it, when you're having sex with someone, they may say, they did not come in you, but any fluid that comes exchanges between you two, and you've not had protected, you're not using a condom, can put you at risk for HIV. Also, I mentioned people who inject drugs, who share drugs, also have a higher chance of acquiring HIV. And most people don't know their status. And again, before, some of us who are much older, we saw the face of HIV. People were losing weight, people were getting sick. But now, because of antiretroviral therapy, people look healthier than actual people who are not living with HIV. So you can never know somebody who's living with HIV until they show you their HIV test results. And people don't have HIV, don't have symptoms for a long time. So where are there differences when I say that there are women, women have a higher chance of acquiring HIV? Unfortunately, we have a large surface area of transmission. Our vaginal area is bigger. You can imagine the anatomy of a man and an anatomy of a woman. The man only has a penis, which doesn't have much surface area. You've got this bowl inside, the cervix, the vaginal area that has a lot of tissues, a lot of blood vessels, a lot of fluids, and this creates a risk for HIV transmission. Again, for young girls, under the age of 24, the reproductive tract is still maturing, so they have a higher chance of acquiring HIV because they are still growing. Bacterial infections also put you at risk for HIV. Um, and then also just gender inequality and harmful social norms. For example, if a man comes and he forces you on himself, these this can create can cause you to tear, which increases increases the chances of acquiring HIV. Also, some people inherit wives, not knowing what are the causes of the death of the husband. And then also women are not supposed to speak up, in the homestead in traditional gender norms. And so you might be in an abusive relationship, your husband might be, or your partner might be out there, not using a condom, but you remain faithful and you stay at home because that's what you're supposed to do. And so those are the societal norms that really keep women not being able to have a voice. And then also just condom negotiation, as girls also, even not in a relationship, if you carry your condom, when you're out partying with your friends, now you become, oh, she's loose, she carries condoms with her. But you're actually trying to protect yourself. And so that idea of a woman being empowered to take care of herself, also that stigma that comes with that also really increases the chances of acquiring HIV, because some of us are not empowered to take care of ourselves. I just mentioned that we do not know our rights. Sometimes we cannot negotiate condom use. We're uncomfortable about talking about sexual matters with our partners because of this, just the gender norms and how we've been brought up. And then also we experience a lot of violence and rape as women. But I also just want to say, despite all that, there is a drug called PrEP that's available to everyone who cannot negotiate sex, who's also just if you're in college, if you're going out there and you don't know if I'll be drinking and I'll end up going with this guy home, and I might not be able to negotiate condom use, then there's this drug called PrEP, which is pre-exposure. It's called pre-exposure prophylaxis. Pre meaning before, exposure is coming into contact with HIV, and treatment, of course, a prophylaxis is a treatment for is to prevent HIV. And this drug, for women, they have to take it every day, and it has a 99% chance of preventing you from acquiring HIV. And some of you may have heard about it, but if it's use condoms, but also take PrEP if you're gonna be out there and hanging out with your partying and going home with guys who you don't know you don't know their status. Okay, so I've talked about alcohol. I've talked about substance use. I have talked about um I've talked about violence, and I have talked about risky sex or sexual risk. The reason why we really try and talk about the nexus of these three things is that when you're drinking alcohol, or when you're high on drugs, or when you're down on drugs, for example, like you've gone out and you've clubbed with your friends and you've blacked out, the chances, or not even blacked out, but also that you're really high and you can't really have proper decision making or control of the decisions that you make. When you do that, somebody can really take advantage of you. Either they can rape you, or they can also they can also be some violence, but also you have a chance of going home, or increase the number of partners that you have, and also having unprotected sex, because your reasoning is compromised. Um, Also, hanging out with sometimes you've seen when people drink alcohol or take drugs, they become violent. And so that also now increases it becomes a cycle where there's poor decision making, and there's also really risk of HIV and STIs also, because of condoms protect you from STIs. So these are linked factors. So the reason why I went through the drugs, first of all, is that we don't know much. People don't really know about drugs, and also especially like alcohol. As young people, we don't use it as we used to. I think now we're moving on to quick drugs, but also just understanding that, when you're under the influence, the ch the chances of you making a decision, a sober decision, is very, very low. And so that puts you at risk for acquiring HIV and STIs, and also at the same time, getting pregnant, because if you're not using a condom, you may get pregnant. Um, so really, I was just thinking about just the different ways, like when you're out with your friends, what really should do. And we're not saying that, don't go out, don't go out. Okay. We're talking about harm reduction. Even alcohol is, I'm not saying don't drink alcohol, but be wise about how you're drinking it, okay? And so when you go out with your friends, stay with a friend. Don't go alone, have a buddy, with you. And then also watch what you drink. Never leave your drink unattended. Um, don't accept drinks from just anyone. Make sure that your drink is covered, or if you're buying a beer, that it still has the cork, the top on it. And if it tastes funny, it is funny. Don't drink it. Okay. Then again, limit your alcohol use again. Alcohol impairs judgment, and they make us women vulnerable. And then also just pace your drinking. Alternate alcohol drinks with water or soft drinks. Um, Mixes are the worst. They taste so good, but those can bring you high so fast, and you have no control. Also, don't take drinks. If a guy buys you a drink, don't feel indebted to them. You don't owe them anything unless you had a conversation before about it. But don't feel like just because he bought me a drink that I have to go home with him, or I have to let him talk to me in a certain way. You have to trust your instincts also. If you're uncomfortable about a situation, then you are uncomfortable. So listen to your intuition. Um, you know, Set your boundaries clearly. And so these things I'm telling you to do is when you're sober. So you can imagine, if when you're drunk, you're not able to set boundaries. And then also have an exit plan. You always know where the exit is, and also keep your phone charged at all times, because you never know when you'll need it. And then again, if you go to a place on your own, if you've got a trusted friend, share your location, tell them this is where I am. And then also use go out to a safe venue. And then also, when you see an inappropriate behavior, if your friends are being harassed, you know, be an active bystander, and speak up. Okay. And then educate yourself on how to protect yourself, and just be vigilant. And then another thing that we always do is we always take an Uber home. So, or a ride sharing service. So make sure that you verify the ride. The good thing with Uber is that that it's verified already. And I think there are codes now that you can actually use. That's again, as I mentioned, that's again where alcohol and drugs use comes, because you're not going to be able to do all these things when you're really, really high. Also share your trip details, maybe with a friend. I always do that also with my friends when we go out, that I tell them that I've gotten home safely. And then also sit strategically in the back seat, because sometimes if you're going out late, being sure to know that this door is, close to the door. Don't sit in the middle, sit at the door, so that if anything happens, that you're able to get out when you can. Um, And then also just limit your personal information with Uber drivers, especially at night. And then also report any uncomfortable behavior that you see in a Uber driver. And then most importantly, if you're able to travel together, do that. Right? Okay. So remember again that no means no. So just lessons that we've learned in HIV research for women in general is that gender inequality drives vulnerability. We just talked about that because of the gender inequalities that we've had, especially in sub-Saharan Africa, we are so vulnerable that we stay in relationships. We get into, we stay in relationships that are really bad for us. We also are, we hang out with friends, lots of peers who make us, use alcohol and drugs because we want to fit in. And then also gender-based violence is really a critical driver for HIV, as I've mentioned. And the intersectionality of those three, the HIV, gender-based violence, and also substance use really matters. And so just as we look at programming, we look at programs that really try to tackle all those other issues that make young women make decisions. Also stigma and discrimination is also a big issue, and health literacy, like knowing what must I do as a young person to keep myself healthy. And also we need to respect each other and also respect women where they are. And so as I finish up, it's really important to have a circle of safety, because there are all these issues that we cannot change as an individual. There are these gender norms, there are other sex partners, there's violence, there's HIV, there's alcohol, drugs, and then there's peer pressure from friends, because that's really huge for young people, is that there's so much pressure to fit in that really makes us vulnerable. And so when you have a circle of safety that can really prevent you from being a victim or vulnerable to these things, then you're heading in the right direction. And a circle of safety is people around you who understand the same issues as you do, and people who protect you, people who will be there for you and sort of support you as a buddy. And these are your peers. This is somebody older who mentors you. And then also this parents, also some parents, your aunt, and somebody who just really understands you as a young person. So yeah, so that's the end. Yeah.
Thank you, Jackie. That was a lot of information, but very valuable. And I'm sure most of us know this, or we've come across this information somewhere along the way, or we've had experiences. So none of this was new to us, but it was just nice to have it condensed together, and also as a reminder, because sometimes we get very relaxed and we forget. So thank you so much for that. I'm going to open the floor. Would anyone like to ask Jackie any questions while we have her?
I see a question from Precious. And she asks, what's your take on condoms being free, but pads have to be have to be bought? Yes, that's a big campaign we've had because it is a big issue, especially for young women, to be able to continue to go to school, to continue to be functional during their period. And again, these are the things that we fight for in public health, because HIV affects both male and female, but period tax is just female. And so it's very hard to fight for this because again, it's economy and what makes it work in the world generally. But I think there's lots of people who are fighting for this because it really puts back, the productivity of women when they're on their period. Um, and also it just people are going to manufacture condoms that governments are going to buy, but not many people manufacture pads because they cost a lot of money to make, but also that the companies that make them and get a lot of money out of selling them. So it's just really it's just the economies of these, that there's such a I don't know how to say it, that the interest is, there's some internal interest in production of condoms versus production of pads. Although there are people who are actually learning how to produce pads from cloth and other things, but also again, it's just the comfortability of, of wearing a pad that's made out of cloth also. So there, to mention, just to mention that we're really trying to fight for free pads, but again, it's just the people who benefit at the end of the day um from purchasing and producing pads versus condoms.
Thank you, Jackie. Are there any other questions?
Hi, Jackie, Garby here.
Hi. Hi, Carbo.
Yeah. So, well, this is not a question, right? This is just a comment. And it, as you were talking about, GPV and all of that, it made me, it took me back actually to when I was still young, when my mom was in an abusive relationship with this man. So I realized that, sometimes it was so hard for my mom to leave because this man was so loving, and as much as he was my stepdad, he would like literally care for me, buy me nice things. But it took courage and strength for my mom to leave that relationship because my late grandmother told my mom that you need to leave this relationship, otherwise we're gonna bury you. But she realized that she has a young girl, things can happen, and sometimes staying in a relationship where it's very toxic, and for someone who's jealous and buying things for your daughter or your child, it's not good at all.
Yeah.
So yeah, I'm so grateful for having this conversation because I hope like every lady out there would literally learn. I know it's not easy, but I just hope that they could take away something from this. So
Mhm.
yeah, thank you.
Thank you. Thank you so much, Carabo. Yes, there are numerous situations where women stay in relationships for the sake of their children, especially because you leave a relationship and then what happens? You don't have a house, you don't have all those nice things, you don't have education, and also the children are going to school, you're having something to eat. And so sometimes women really sacrifice that for the sake of their children, and you'd rather be in the relationship so that your children can flourish, and then really take care of yourself. And it's really hard. And so, and as you can see, sometimes women also end up using alcohol and drugs because they're like, I'm in this relationship, I can't get out, I need to numb myself, and so I'll just take something to numb myself. And at the same time, she's in an abusive relationship, and so with all this, and he doesn't know where the man has been. And so the intersection also, because he could be out there with somebody else and can bring an STI, can bring HIV. But at the same time, we don't think about that. We really think about our children, and we're like, you know what, I'm going to sacrifice everything for them so that at least they have a roof over their head and something to eat. So women do sacrifice so much, but at the same time, it's a double-edged sword.
Mm,
Yeah.
true.
Any other comments or questions? Karabo, thank you for sharing.
Thank you.
Hi, Jackie. I just wanted to ask, how do we educate our children who are in the range, as you said, from a teenage age about substance abuse? And like you said, I mean, now in South Africa, it traumatizes me that you can just be at a restaurant and someone's smoking dagga,
Mhm.
and so what? And we unfortunately are next to a primary school, a public primary high school where my children go to school, and those kids, they're vaping, they're like it's not a thing, right? So how do you educate your child in a way that they understand and then don't fall under peer pressure without sometimes people get enticed by knowledge, instead of them
Yes.
instead of them thinking stay away, they're like, ooh, let me try to
No.
figure out what that is. What's your take on that?
Hi, Joanne. For sure, I think it's really it's all about harm reduction. We know that abstinence is not going to work. I think if, children, we're all curious about why we're told not to do certain things. So my take would really to be to educate them exactly what drugs are. This is what happens. This is what happens to you when you take this, and this is how it looks like, and this is what might happen to you in the future when you're taking it. And for Dacha, I know it's so common, especially in South Africa, because it's legalized and it's hard to know where it's coming from. And I think you've got to just educate them that, why don't you wait till you're 18 so that you're able to buy Dacha and know exactly where it's coming from? Because right now it's being, all the drugs I've told you, like heroin, battery fluid, all those things are being put in heroin, and it's not good. So I think it's just providing them with as much information that is out there, for them to make, you know, I mean, they're still young to make an informed decision, but also to know, to be able to recognize what Dacha looks like, what buttons look like, not to accept sweets and from friends, because like as I mentioned, Mandrax has looks like Tums, it looks like I don't know what this candy, I've forgotten what the name is. But anyway, it's not to accept certain like sweets and things like that from strangers or for people, even their own friends. They need to check them also. And I think also is also checking with your friend, with your the parents of your friends, what they are talking about, your daughters or your sons parents, what they are talking about, because there are all these sleepovers, and when your children are not close to you, that you're all on the same page when it comes to things like that. So for drugs especially, I think you should provide as much information as you can out there, and also the consequences um, of taking drugs, and you can make it as hard as possible for them. And especially like in this world, it's so hard. There's so much information you can give, but then there's the internet, and there are also peers. So that also is a big influence. So I think you do that, and then just pray to God that they don't do it, because it's I don't think you can protect your child too much, but I think providing them with the information they need is 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 important. Another thing also is also putting them in a situation where, I think at this age, I think at the age of 11 or 12 or so, I think you also need to talk about protected sex, because it is they'll go out with their friends, and they'll be in a compromising situation, and that we need to start talking to them earlier about these things and stop protecting them, because these things are happening so fast. And so at the time where they are in a situation, that they make an informed decision about sex, and when it comes to drugs also. I hope I've
Thank
answered.
you.
Yeah. Okay. Okay. Uh, my question is, how do I help a friend who's using drugs to cope? I asked him why he smokes, he drinks, he says it's stress. I really want to help him without actually being judgmental and pushy. How do I approach the matter without offending them? I've tried and says he will stop, but it's a losing game. Yes, unfortunately, that's the hard one, is that somebody to stop taking drugs, they've got to be ready. They themselves have to understand that it's a problem and that they need to be ready. So you really just have to be supportive and just keep, you could also just find like a rehab center or rehab materials and give it to them and say, I really want to help you as a friend. there's this place that, you know, you could try and go, and I'm going to support you, but don't expect them to go if they're not ready. So I think you just have to be, unfortunately, you have to be that supportive friend, and you know, and just keep telling them, you know what, your situation is making me sad. But you know, I think if you try this rehab center, and when you're ready, you can, you know, I'll take you there and I'm going to support you through it. And like the worst part also, the hard part also is, even though when they go there, the hard part is when they're back into society, a lot of people relapse, because it's different, you know, like they've been dealing with, um like now they're stressed. So you also need to find out what is stressing them. You know, is it a job? Is it school? Is it family? And you've got to deal with that stressor first, because if we don't deal that stressor, they're going to relapse. They're going to go back to um dealing with it. And also, once you find out what the stress is, you can help them figure out how to deal with that stress in a productive way, that doesn't need drugs. But first, depending also on the drugs that they're taking, they need to go to rehab, because I mentioned like heroin and cocaine, onyaope, it's really hard to do it on your own, um, because you will feel like you're about to die, and people get scared of just getting to that point. So you have to be supportive. You've got to be, that person has to be ready, and you have to deal with the stressors. So I hope that's helpful.
Yes,
Do
it
you
is.
think,
Thank you so much.
thank you, Alia. Do you think HIV and pregnancy stereotype has ended in the, do you think the HIV and pregnancy stereotype has ended in the hospital and public areas, because considering how people, it's so funny because I work with young people here in Nairobi, and young people are more scared of getting pregnant than getting HIV. And I think it's the same thing also in South Africa, because HIV, as I mentioned, it's something that has been normalized in a sense, because people are like, oh, I'll take ARVs. And ARVs are really tough to take. Imagine taking a pill every day for the rest of your life. You've got to take that. But pregnancy is like, I'm not going to hide it. In 9 months, this be a human, and I have to be responsible for this human. So in the hospitals, there's still stigma, unfortunately, for young people, because you know, young people should not be getting pregnant. HIV is less stigmatizing as such, because there's a dedicated area for you to go get your medications, to get tested. But pregnancy, unfortunately, is still stigmatized for young people in the hospitals. And we actually had a project in Pretoria where we're trying to address those issues, because the nurses in the hospitals always treat the young people as their own daughters. So they're like, why are you coming for family planning? You know, and the young people said, please don't call it family planning, because it's not about family planning, it's birth control. Family planning puts it in a situation where it's like to do with family, marriage, you know, husband and wife and children and all that. But birth control is, I'm trying to prevent getting an unplanned pregnancy. I'm sexually active. I'm over the age of 18. And so I think there's still that issue in the clinics of getting birth control, and you know, and also just young people. Even when young people get pregnant, there's still a lot of stigma in the clinics for them to even go for antenatal clinic, and they normally will just end up when the baby is to be born. So I think the government is trying to work on that, but it's still an issue. It's still an issue.
So I'll open the floor. 2 last questions. Are there any more questions? Mwenya, Caroline, Tabi saying, nice to see you online. Nina, Nokutenda, no questions? Okay, so we've more or less reached, you know, we've more or less exactly an hour, which is what we always try to do for these talks, so that we don't take so much of people's time, but at the same time, we're still learning something new. Tabi saying, you've unmuted yourself. Did you want to say something?
I wanted to say hi. I miss the G4G community. Hello, everyone.
Hi, Ntabiseng. We miss you too. We miss you too. Ntabiseng is now living, I think, in the Free State.
Yes.
Yeah, but you're still part of us, so don't worry. Okay, so if there are no further questions, I would just like to thank Jackie for your time and for sharing your knowledge. We really appreciate it. We hope that if there's other topics in the future that you feel can be beneficial to our community, you can just reach out to me and let me know. And yeah, just to wish everybody a beautiful evening and enjoy the week ahead. Thank you.
Thank you. Thank you so much.
Thank
Asante, Jackie.
Good evening. Thank
you.
you.
Thank you.
Bye-bye. Bye.
Bye.